Welcome back to Consider This. I'm Melisa, Idris with me, Sharaad, Kuttan. We're chatting tonight to the head of the Cluster on Health and Emerging Hazards for NADMA, Datuk Dr. Ahmad Faizal Perdaus. So just to come back on the public response to the COVID-19 virus, lately we've heard news that some universities have taken the preemptive move to postpone face-to-face lectures, postpone classes for more than a week. Now, I'm wondering whether those preemptive measures are the necessary response to curb the spread of the virus. What do you think, Doctor?
We actually had a discussion on some of these preemptive measures yesterday at NADMA and at the Prime Minister's Department. And at the moment, we are in agreement that the measures taken by the government and the Ministry of Health in particular at the moment are adequate. This includes, of course, the government's decision at the moment to actually have a travel ban, have a stop receiving order for patients or for persons coming from Wuhan, from Hubei, and two other provinces which are under lockdown in China. We feel that that is reasonable. We feel also that the measures currently undertaken at our entry points, immigration entry points, both north and south, are adequate. The fact that Malaysia and Singapore now have a joint task force on this matter is a very good thing, given the proximity of Singapore and Malaysia and the number of Malaysians actually working in Singapore, especially out of Johor Bahru, and the fact that the government also has put the Ministry of Health at its highest state of alert and readiness, and the Ministry of Health has responded remarkably well, I would say, and have done outstanding work over the last 3 weeks or so, and which has managed to keep our infection low, as well as treat some of these patients well, and some of them have already been discharged. And
I'm going to infer from your answer that the actions of UIA and University of Malaysia might be unnecessary, considering all these things that have taken place.
We had a discussion with a couple of the university representatives informally, and we understand why the measures were taken. What we would advise, though, is that for universities or any other institutions, for that matter, if they were to undertake such measures, that they first consult with the Ministry of Health, and also get direction. Each institution might be slightly different, and the Ministry of Health and the Ministry of Education in this particular case might have a slightly different answer to a particular institution's request or question. This will be dependent on, for example, number one, the number of Chinese nationals who are their students,
who might have been exposed to
One of the reasons we found out yesterday at our discussion was that some of these Chinese students actually went back for the Lunar New Year, for Chinese New Year, and actually came back before the travel ban and the stop receiving persons from certain provinces order was actually given. Okay. Some of them, the university authorities did not know much about their whereabouts, whether they did actually go back or not. Yeah, and these were some of the considerations we were told that why these universities made those decisions. However, after further discussions, our recommendation as a panel was actually to recommend that that each institution, be it a university or a corporate body or a business, actually look carefully at the numbers and the people involved, and actually advise that if they did actually have travelled back to China and come back, that they go for screening, and when
there's something much more surgical or precise in the response. Yeah. And the reason I brought this up is because the logic would be that if this was a good move on the part of those two universities, why not shut down all the universities? In fact, what pressure might there be for all institutions to shut down? I mean, there might be a kind of cascading effect that comes from approving the decisions made on an institutional level, right? I mean, there might be a danger of that actually overreaction now then being much more generalized.
So that's why, after considering that each university would be different in terms of the number of Chinese nationals it has as its students, etc., given that we also recognize we have more than 20 public universities at the moment and countless numbers of private institutions of higher learning. So our recommendation yesterday was for both the MOE, Ministry of Education, and for the Ministry of Health to come together and to actually come up with a policy framework and guideline, which would include things like we recommended, like the screening, for example. And one particular private university has already done that.
Okay.
Segi University College, I think, has already actually done that. And it could be argued, of course, that to do that then would incur some costs, yeah? And who would bear the costs?
I mean, these are all
these
questions
processes?
that
These are all questions.
need to be weighed.
And they need to be weighed. And the Director General of each ministry, and together with the Director General of NADMA, would probably be discussing this at the National Disaster Management Committee.
So I want to touch on the point where with outbreaks like this, often people feel helpless, like they want to do whatever they can to prevent them from getting the disease or the virus, because it can feel random at times and out of control. And I'm wondering, because you touched a little bit earlier about not overdoing it, and I still see people wearing masks even though they have no flu symptoms, no matter how many times the health minister will say you don't have to wear a mask if you don't have flu symptoms. How do you balance the caution over the panic?
Yes, this is it. I mean, the rationale against the fear. And I think, Sharaad, even at to go back to your question about some universities, there is that question of that balance again, yeah. And I guess people, either individuals as well as managers, like managers of universities or institutions or corporate bodies, will have to make these decisions in a balanced way. While considering the fears of staff or of other students, for example, in a university, they have to balance it and rationalize it against what's really happening out there. What's really happening is that we have a very highly intensive infection occurring in Wuhan and by extension in Hubei. And about 3 other provinces now have crossed the 1,000 over confirmed cases marked. In all other provinces of China, the numbers, if you go by the population of China as a whole, are still quite reasonable. They're not over, or they're not in the numbers that we would be extremely worried about. But in these 3 to 4 provinces, including Hubei and the city of Wuhan, of course, things are extremely bad. The case fatality rate in Hubei and Wuhan is 3 to 4 times higher than the rest of China. And at the moment, we only have 1 fatality outside of China, outside of Hong Kong, which includes Hong Kong, by the way, which is in the Philippines. There are over 400 cases already outside of China, only 1 death. And in Malaysia, we have 19 cases. And as far as we know, there was 1 case, as reported by the Ministry of Health, which had been in intensive care. But thankfully, that particular patient has been treated well and has recovered. All other cases are stable at the moment. So with that, I think everyone needs to take a step back, take a deep breath, and look at the facts.
Not too deep.
And not too deep. Look at the facts and really, while we must be vigilant and we must be careful and we must be aware, this is perhaps the most important characteristic that we should have: awareness. That we should be aware of our surroundings, aware of who's coughing, who's ill, yes, who's not, yes, and take extra precautions if you are in an extraordinary circumstance, like what I said earlier. If you're in an airplane, if you're in a crowded, packed LRT coach. LRT coaches are smaller than MRT ones, if you've noticed, yes, or in any other situation where close contact becomes more of a norm.
Inevitable.
Yes? Inevitable.
Okay.
Yeah. But otherwise, in other situations, while in those kinds of situations, for example, a mask might be something to wear, especially if you do have people coughing around you, yes. In other situations, like if you're out on the street, if you yourself are not coughing, and if you yourself are not having any symptoms, and if you yourself are not extremely allergic, for example, to the dust that's flying around, there's actually no reason for you to wear a mask, and so there should be no reason for everyone to panic buy masks. Although yes, you should have a few masks at home.
Right.
So there is a big difference between having a few masks at home and one person overbuying and having 4 boxes of masks just to himself.
Hoarding.
Hoarding it.
Yes.
So this is the situation. And so like we touched earlier, if one keeps oneself at the prime of one's health optimally, and look after oneself and be aware of one's surroundings, take the most advised precaution, which is to always keep your hands clean and wash them frequently if you can. Wear the mask when necessary. If you feel so. And this will stop the mask from being, we had the Minister for Domestic Trade yesterday saying that, there'll be hundreds of thousands more masks coming in, yes? But they'll be gone in a jiffy if everyone buys them up in a panic mode. Yes?
And uses them incorrectly.
So, and also deprive people who really need the mask. And what WHO is particularly worried about where these masks are concerned, even at the global level, is that people who really need the mask will be short of them. And who do really need the mask? Healthcare workers, people who are in the front lines treating patients, patients' close relatives, persons under investigations, persons under surveillance by the ministries of health all over the world, including ours. So these people need the mask more than the general population. So that's where the rationale should overtake the fear.
All right, we're going to take a quick break. We'll be right back on Consider This. Stay tuned.